Good morning. Now, time for your weekly Kasuth Regional Health Center report. I'm Mike Vandy. I'm joined this time around with Rhonda Sexton. We've had Rhonda on the show before, and if you don't know, Rhonda Sexton is the RN, ER, and outpatient coordinator at the Kasuth Regional Health Center. A good morning to you here, Rhonda. As we begin the program, we're with you because February is Heart Month. It's Heart Health Month, and it seems appropriate for us to talk about what we can do to have a healthy heart. Now, can you describe to us what a coronary heart disease is and why it is important for us to prevent this disease?
Good morning, Mike. Thank you for having me. Coronary artery heart disease is a narrowing or a blockage of the arteries that provide oxygen and nutrients to your heart. This disease is also called atherosclerosis, which is an accumulation of fatty materials on the inner lining of your heart's arteries. As this plaquing becomes thickened, less blood flow can get to your heart's muscle. This can cause chest discomfort or a heart attack if the blood flow to the heart artery is totally occluded.
Now, can you share with our listeners the screenings that are available at the Kasuth Regional Health Center that can detect if a patient is at high risk of a heart disease?
Coronary heart disease begins in childhood, so that by the teenage years, there is already evidence that plaque will stay with us for the rest of our life in most people. Preventative measures instituted early in healthy lifestyles will delay this progression of coronary artery disease. When you come in for a wellness exam with your provider, it is important that you know your risk factors for heart disease. The first one to discuss is your blood pressure. Blood pressure is a measurement of the force on the walls of your arteries as your heart pumps blood through your body. We would like this number to read 120 over 80 or less. Your blood pressure should be assessed because it often does not have any symptoms when it is elevated. Next, your blood cholesterol level is important. Cholesterol is the waxy, fat-like substance that occurs naturally in all parts of our body. We would like your total cholesterol number to be less than 200. Another important number to discuss with your provider is your body mass index. This is a measure of body fat based on your height and your weight. Your provider will be able to discuss this number with you, and it should be less than 25. Your blood sugar level is also an important indicator of your risk for heart disease and diabetes. Your fasting blood sugar level should be less than 100. You are also at higher risk of developing heart disease if an immediate family member has had a heart event. This includes your parents or your siblings.
Now, as we continue here on our Kasuth Regional Health Center report again, Mike Vandy joined this time around with Rhonda Sexton. Besides finding out your important numbers that we just talked about there, what are some other things a person can do to decrease their risk of heart disease?
Smoking is also an important risk factor in causing heart disease. If you currently smoke, talk to your healthcare provider about approaches you can to stop. Start eating a healthy heart diet. This includes eating in moderation and eating a well-balanced diet, including healthy proteins, fruits, vegetables, and low-fat foods. Avoiding or minimizing caffeine through coffee and sodas will also help you feel better. Drinking 6 to 8 glasses of water a day is important for hydration, even through these winter months. It is also important to increase your activity. Living an active lifestyle is one of the most rewarding gifts you can give yourself physically and mentally. Go for a walk with a spouse or friend, join a local fitness center, swim, dance, or whatever you enjoy doing, but just stay active.
Now, if a patient does have a heart event that we've talked about here, what other resources are available to your patients?
Kasuth Regional Health Center has an outpatient cardiac rehab program for patients who have gone through a heart event, such as a myocardial infarction, also known as a heart attack, open heart surgery, or had a stent placed in a coronary artery. We also care for patients who have congestive heart failure or have had a valve replaced in their heart. Cardiac rehab doesn't change your past, but it can improve your heart's future. This program is medically supervised and designed to improve your cardiovascular health. The program includes exercise counseling and training, education for heart-healthy living, and emotional and stress reduction counseling. We also do teaching on your heart medications and why they are so important in your healing process, and to also prevent future heart events.
Now, what are some resources a person could refer to if they would like additional education on heart disease, risk factors, and living a heart-healthy life?
Getting the conversation started with your provider at the wellness exam is a great place to start discussing if you are at risk for heart disease, reviewing those numbers that we mentioned before. The American Heart Association website, www.aha.com, is a great resource with endless amounts of information of heart disease, heart testing, treatment for heart disease, and tips on how to live a healthy lifestyle. Please feel free also to call me, Rhonda Sexton, at 295-2451 with any questions you may have about our cardiac rehab program here at KRHC.
Rhonda, always a pleasure talking with you here.
Thank you, Mike. I appreciate it.
This has been your weekly Kossuth Regional Health Center report. You can hear a new report every Thursday in the 9 o'clock hour, about 9:05, the start time for that program. And on Tuesday, that's right, you get a repeat of the show on Tuesdays, about the same time, 9:05, heard right here on Hometown Radio, KLGA.